You just found out you're pregnant, and you may feel a little bit overwhelmed. You don't look pregnant, but you certainly feel different. Catherine Calloway has more on the first trimester in which your body goes through an almost invisible but incredible transformation.
You're eating well, you're taking your prenatal vitamins, getting plenty of rest.
Dr. Michael Randell has seen the Pinkhams through their first trimester of pregnancy, which for Kelly was a difficult 13 weeks, full of nausea and fatigue.
I was never throwing up my food like some people experience. It was dry heaving, and it would come on in the middle of the night, 12:30, 1 o'clock. And I was tired all the time. I couldn't get out of bed, or taking a bath and getting out of the tub would exhaust me.
Dr. Randell says rest is important, and there are simple things you can do to reduce the nausea.
There are some behavioral things that you can do to improve it before we go into medications, but small frequent meals, avoiding any fatty, fried, greasy foods. Don't suck on hard candies. That stimulates the GI tract and may make matters worse. You can try the ginger ale, you can try peppermint, things that have been shown to work, but bland is best. Baked potato, no sour cream, no butter. Any carbohydrate, starches really help with that morning sickness.
Your first trimester prenatal appointments will probably be some of your longest, as you'll have lots of questions. Your doctor will establish a due date and take a full medical history of you and your baby's father.
We do a lot of testing during that time, and that's the most critical time of the pregnancy because that's when everything's being formed. The rest of the time it's all growing.
In addition to monthly visits to your healthcare provider, you'll want to make sure that you're eating a healthy diet. Minimize caffeine, avoid alcohol. Under are uncooked foods like sushi, uncooked deli meats, fish high in mercury such as swordfish, shark, king mackerel, and tilefish, and anything unpasteurized. Exercise, but not to the point of exhaustion, and avoid contact sports. You may notice cravings for certain foods and see changes in your body.
Your weight changes as a result of increased blood volume, the breasts change, and then you start having the weight of the baby contributing to the weight later on in the pregnancy, as well as the amniotic fluid, as well as the placenta weight. So there's a lot of hormonal changes, mood changes that occur during pregnancy, a lot of emotions. So let's go ahead and try to listen.
Hearing your baby's heartbeat during the first trimester will ease some of the anxiety that you might be feeling.
I love this part.
You probably don't feel movement until maybe 16, 17 weeks, so there's no way of knowing that everything is okay. And you're also seeing the doctor every 4 weeks, so that's a long period of time. 4 weeks go by without that reassurance.
The ultrasound of your baby may be difficult to distinguish at first, but as the weeks go on, the image of your baby becomes clear. Kelly is now at 16 weeks and feeling better and no longer taking 2 naps a day.
The best part, that I'm pregnant, that I'm making a baby, and that's I'm gonna cry.
Oh, that hurt.
It was so emotional.
For CNN, I'm Catherine Calloway.